Hi there.
Hi,
What's your name?
Katherine Jungreis.
And what do you do at Simmons?
I am faculty at the social work school, and I teach primarily practice classes and theory classes, behavior classes. Actually, I've taught a number of other things I just realized as well.
What is your area of strength? Or your interest area?
Okay, so one of the advantages of having been around for as long as I have is that you go through various stages, and so I've actually been interested in lots of different things. Some particular areas of interest of mine are working with folks with mental illness and with their families. I'm very interested in supervision and helping people to maximize their use of good clinical supervision. I'm very interested in theory and how that really informs practice. And I'm interested in integrating spirituality in therapy.
Do you know that May is Mental Health Month, and I'm wondering if you could tell the online student what are 3 important things they should know about mental illness and working with mentally ill clients?
Okay, so I would say that the first thing you probably should be thinking about is how best to help understand what mental illness is about and the different kinds of mental illnesses, so that you can best help the clients you see to get clarity about what may be going on for their experience. The second thing I would say is to really join in this newer paradigm about thinking not so much of the pathology, but really thinking in terms of a recovery model, a hopeful model, a model about what do people want to do with their lives, and then what obstacles get in the way, and how can you best help them with that. And the third one, which is a strong feeling I have, is that families sometimes get marginalized in this experience, and they are core to the experience. If we're anything, we are social workers. We are about people in context, and we all live in our families. So I would highly encourage people to consider getting involved and being collaborative with all the people who are involved with someone who has mental illness.
And my last question to you is, what do you think social work students and social workers can do to address the stigma that mental illness still has in our society?
Absolutely. So yes, that is a major problem, as people may know, that stigma really can become a huge obstacle both for people seeking assistance and also, for what gets internalized in terms of their experience. Probably the most helpful thing is to make it clear to people that mental illness is an illness like other illnesses, and that it is not something that should be causing shame and blame, and that what we really want to do is to make it less of a scary topic and less of a topic that people don't feel comfortable talking about. And I have to say, it's really been helpful. The more famous people have come out and talked about their illnesses, the more successful people have done that. I think that that's done a lot to combat stigma.
Great. Thanks so much.
Bye-bye.